Hi, this is Muscle Activation Technique Specialist Chris Vercelli, and I'm going to introduce you today to something that has changed my life, my clients' lives, and the lives of thousands of people across the world by helping us address the root cause of our physical ailments and allow our bodies to heal from painful conditions that some of us even struggled with for decades. I'm going to show you how it works, why it works, and introduce you to some of my clients so they can tell you how much it's helped them. Now, if you have an annoying physical ailment that's hurting your quality of life, then this message will be of great benefit to you. If you're like most of my clients, then you've probably invested a lot of time and money getting help from doctors, therapists, or chiropractors, and you're frustrated that you haven't gotten the full lasting relief that you wanted. Now, by now, you're probably just searching for anything that will make you feel better without a bunch of nasty side effects. Now, by the end of this video, you will realize that muscle activation techniques could be that one thing that you've been searching for. Sound like a lot of hype? Well, just listen to what some of my clients had to say about how much I've been able to help them using muscle activation techniques.
I struggled with back injuries for about 9 to 10 years now, and the muscle activation techniques have really helped me regain just simple abilities like playing with my kids and helping my wife around the house and things like that in ways that I couldn't do so before.
It was really tight. I've been in real bad pain. After we did the treatment, it felt like it's floating, like I'm on air.
So is this the best you've ever felt after one treatment of something?
The best.
And after the very first session, I could stand up without any pain whatsoever that lasted about 18 hours, and after the next 2 or 3, I was completely healed.
My back was hurting me for a couple of days. I came in here and got me stretched out 15 minutes, and now the pain's gone.
And lo and behold, within about 15 minutes, I was back up, walking again, had no pain, and I was just totally impressed by what muscle activation techniques did for me right then.
The proof is in the actual work, and a couple sessions with Chris got me all squared away, and I'm here to say that I now enjoy things that a month ago I wasn't able to enjoy.
Came across Chris, and he's been working with me now for 4 or 5 weeks, and I'm much better. My body is much more flexible, and I'm even back playing golf.
So now tell me how you're feeling in comparison to how you were when you first came in.
I'd say probably 75% better.
And he worked on me, and in one visit took care of a chronic shoulder injury that I'd been dealing with for quite a while. And I tried everything to fix this shoulder problem. Exercises, physical therapy, adjusting, and nothing helped until I went through the MAT protocol.
He started working with me, and right away I was so impressed because he went right to the he was able to diagnose the core of the issue, the problem, the source of the problem, and went right to it, alleviated the pain. But not only did he alleviate the pain, he went right to the issue that was causing the whole thing.
What I find beneficial is that I have peace of mind because I know if something hurts that Chris can fix it.
I have been feeling 100% since I started with him, so it's been a miracle.
Once he gets that body working in tandem again, the muscles all working with each other, it greatly improves the quality of your life. I was walking better, moving better, sleeping better.
So I'm really a believer in the muscle activation technique. It was somewhat of a question mark for me at the beginning, but I wasn't quite a great deal of pain, so you get to the point where you're like, just want some relief, and I got that fairly quickly.
MAT for me is the #1 thing that I can honestly say has saved my life, and Chris, I just can't thank you enough for it. It's been a godsend.
Now, before I tell you more about muscle activation techniques, let me first tell you a little bit about myself and why you should listen to me. I came into the field of health and rehabilitation because of how it impacted my life as a teen. From age 15 to 17, I battled with and I was treated for ALL leukemia, which is a cancer that lives in bone marrow. After being battered by the cancer and the chemotherapy for many months, I turned to exercise to get my life back. After my health dramatically changed for the better, I knew I wanted to help other people improve their health too. But what I quickly realized is that most people who want to get healthy have some type of ailment that limits them from becoming more active. Now, I knew that if I wanted to really help people, I needed to find a way to help them recover from those ailments so they could live a more active life. Now, since then, I've completed numerous advanced study courses totaling over 460 credit hours, and I've received 4 elite professional certifications. I'm also one of less than 600 people in the world and only 14 in Florida who have successfully completed the 10-month internship training to become a muscle activation technique specialist. I've worked in gyms, massage studios, physical therapy clinics, and private clubs with every type of client you can imagine. I've also lectured at the Florida College of Natural Health, and I gave the keynote speech at their 2008 graduation ceremony. I've authored a book, and I've had a total of 4 feature articles in the East County Observer and the Bradenton Herald. But all that considered, I have to say the best accomplishment of all comes from helping change someone's life for the better. Now, the way I've been able to help the people you've seen and others is because I was addressing something nobody else was, and that is muscle imbalances. You see, in addition to creating movement, muscles have to secure joints and pull evenly on the skeleton so the body is properly aligned. Now, because of previous injuries, surgeries, traumas to the body, and even periods of prolonged stress, some muscles actually get damaged and, in a sense, get turned off. Now, because of this, the muscles that are still on begin to overpower the others, and this creates a muscle imbalance. Now, muscle imbalances cause the skeletal structure to be pulled out of its proper alignment. This results in too much stress being put on the joints, tendons, ligaments, discs, nerves, and other muscles. Now, this effect in our body is similar to having misaligned wheels on our car. The misalignments to the wheels on our car cause the weight of the car to be distributed on the tires unevenly. Over time, if this is not corrected, this causes an uneven wear pattern to form onto the tires, and if the alignment problem is still not fixed, then over time those tires will keep wearing down until they eventually blow out. Now, this chart illustrates how this happens in our body. The muscle imbalances pull unevenly on our skeletal structures, which pulls them out of its alignment and creates a dysfunction. This dysfunction causes the weight of our body and any external forces to be distributed through the body unevenly. This will cause an uneven wear pattern to the tissues of our body, and if not corrected, then something will eventually blow out, and a condition will form which will cause pain. Now, if you've had your condition long enough, then you've probably received treatment for your dysfunction, your condition, and your pain. This includes things from your medical doctor, your physical therapist, your massage therapist, and your chiropractor. But since you haven't got the lasting relief that you wanted, now it's time to address the root problem, which is the muscle imbalances causing the dysfunction that is creating the painful condition. Now, in order to correct this root problem, you must discover which muscles are turned off and then reactivate or turn them on so they can realign the body. So how do we reactivate the muscles causing the imbalance so that the body can be realigned and healing can take place? Well, it's through a 5-step process called the Muscle Activation Techniques, or MAT, process. Now, in the MAT process, the first step is to assess your range of motion and flexibility on each side of your body to find any limitations or asymmetries. And when the muscle system is perfectly imbalanced, there is an equal amount of range of motion on each side of the body. When it is imbalanced, there is a limitation in range of motion on one side and not the other. And when I see that in a client, I know there is a muscular imbalance somewhere around that joint. Now, in a complete evaluation, I do a full body analysis of each client's range of motion in over 100 different positions and for each joint in the body. Now for demonstration purposes, I will show you 3 of those positions that I found limited on my client Scott. Now as you can see, as Scott goes through his range of motion with his hip, he has less range of motion on his right side versus his left. Now when he goes through the trunk range of motion, you can see he has less rotation on the right side versus the left. Now as he goes through his shoulder range of motion, you can see that he also has less range of motion on his right side versus his left side. This tells me there's some imbalances around those joints that need to be addressed. Step 2 is to test the muscles to determine if they are functioning properly to move the joint and hold it in its proper alignment. Now in these tests, I apply a very small amount of force into a direction to see if the muscle can respond immediately and hold the joint in that position. If the muscle cannot hold the joint in that position, then I know the muscle is not functioning properly and is creating an imbalance that is probably causing pain. Now as you see here, as I test Scott's rectus femoris muscle, he cannot hold that position at all. As I test his external oblique muscle in this trunk rotated position, the same thing happens. He cannot hold the position. Now as I test his upper trapezius muscle in this position, you can see the same thing happens again. Now step 3 in this process is to activate or turn on the muscles that are not functioning properly to get them working again and to correct the imbalance. Now as you can see, I'm doing this on Scott by using a manual palpation technique. Now using this technique is very similar to flipping the circuit in your circuit box and turning the power back on to a certain area of your house. When a muscle is not functioning, its circuit, so to speak, has been shut off, and using the manual palpation technique actually turns that muscle back on. And step 4 is to retest the muscle to ensure its function has been restored, and in this step we go back and check the work that we just did on the previous step to ensure that what we wanted to have happen actually did happen. Now as you can see, as I retest these muscles on Scott, the ones that could not before hold him in these positions now can. This is because the circuit has been flipped and the power is back on to those muscles. Now step 5 is to recheck range of motion to ensure that symmetry has been restored and the imbalance has been eliminated. Now once I see that there is equal range of motion on both sides, I know that the imbalance that was causing the misalignment, which was creating the pain, is now corrected. Now as you can see, as Scott goes through this range of motion again in his hips, he has equal range of motion on his left side as well as on his right side. Now you can also see that as Scott goes through this trunk range of motion, he has equal rotation on his right side and his left side now. And as he goes through this shoulder range of motion, he has equal range on his right side as well as on his left side. The imbalances are corrected and pain is reduced.
Would you recommend it to somebody else that's going through the same problems?
Yes, they really need to try this.
Okay.
So this is highly recommended, and give it a try.
There are a lot of issues that MAT can help resolve, and I greatly encourage everyone, give it a try. It is one of the few treatments I have ever done that you feel results immediately, and it is not painful, and Chris is an absolute joy to work with. You will really enjoy spending time with him.
I would just greatly encourage you that if you're suffering in any area in your body from any type of paralysis or injury to muscles or what have you, seriously consider asking Chris to come over or go wherever he's at and ask him to do one of these therapy sessions that I don't know anybody else can do what Chris does, and I would just highly recommend it.
So now that you've seen what MAT is all about and the great results people have gotten with it, it probably interests you to know its history. Now, MAT was developed by Greg Roskopf over 20 years ago as a way to assess and correct the biomechanical reasons that college and professional athletes were having reoccurring injuries. Now, it was quickly seen that using MAT on these athletes helped them recover faster from their injuries, and it dramatically improved their performance both on and off the field. Now, once it was discovered that MAT worked this well on these million-dollar athletes, many health practitioners wanted to learn to do it on their patients and clients too. Now, since then, MAT has been used with tremendous success by practitioners across the world and in many different clinical settings. And MAT has been used on every type of client, from rehab patients with very little normal function to everyday people just looking to feel better and perform better in their everyday life. So now you have seen how muscle imbalances can contribute to the formation of painful conditions throughout the body. And you have seen how MAT can find and correct those imbalances so healing can take place within the body. And you have heard from real people with issues like yours talk about the amazing results they've had by correcting their muscle imbalances with MAT. So if you're at all curious if you have muscle imbalances contributing to your painful condition, then the first step is to schedule a 10-minute phone interview with me so I can pre-screen you. Now, in this phone interview, I'll ask you some basic health questions, find out more about your condition, and see if it's worth your time and my time to have you take the second step. The second step is to come in for a free 45-minute evaluation where I will examine your body joint by joint and determine how much MAT can help you. Now, to schedule your phone interview, call or text me at 941-735-6223, or you can email me at nonfictionfitness@hotmail.com. Thanks a lot for taking the time to watch this video. I look forward to speaking with you and helping you feel better and get back to life. See you soon.